Hi, folks. It's Dr. Paul Pottinger. I'm one of the adult ID attendings here at University of Washington in Seattle. And it's my pleasure to talk with you briefly about some of the exciting things going on with antimicrobial stewardship here at UW. That's one of the things I do is co-direct our program for stewardship at UW Medical Center, Montlake campus. I'll talk to you briefly about some of the things that are going on here with respect to stewardship. So what I wanted to let you know is that there's lots of things happening. Most of you are probably very savvy with stewardship. Some of you may just be stewardship curious. What is a steward? It sounds medieval, but it's just somebody who takes care of something, a precious resource, on behalf of someone else. All ID doctors, we feel, really should be great stewards of antibiotics. And so we take that responsibility seriously, and we also make it fun. We do this for two reasons, right? If it's the wise, thoughtful use of antimicrobials, most people think about this from a public health perspective. It's interesting. It's really more for clinical care. Job one, make sure your patient gets the best treatment that they can get, safest, most effective way so that your individual patient comes through. And then, yes, the benefit to society overall. That's public health. And we really work on this to make sure that this precious resource is used well, not only for that individual, but for all of society. We emphasize these two different roles because here at UW, we take care of patients and we're responsible for whole populations. And we want our fellows to feel the same way. So things are good here at UW for stewardship. And there's so many reasons. I had a top 10 list, and then the director said, no, that's too long. So I just came up with 5. I was born with 5 fingers. So we'll do our top 5 reasons. Reason number 1, we approach stewardship in a very multidisciplinary way. And we like the idea that we have medical doctors and pharmacists working in partnership to make sure that things are as good as they can be for our patients. Here at UW, I work with Rupali Jain, a pharmacist. We are co-directors. At Harborview, that's Jeannie Chan and Chloe Bryson Kahn, co-directors of stewardship. At our Fred Hutch, or Seattle Cancer Care Alliance, that's Catherine Liu and Frank Verdick, co-directors, doctor and pharmacist. And the same at our VA. We're very proud of our VA, and that's Dr. Louise Tulloch and Jonathan Cassavant, a doctor and a pharmacist working well together. So that's something that we think is important. We rely on our pharmacists, and they in turn are supported by us. We like that interdisciplinary approach, and it's something that we want to model and to make sure that our fellows have access to as well. Reason number 2, mutual trust and respect. Not only trust and respect of ID doctor and ID attending to fellow, but also just generally in the way we approach everything we do at UW. So our concept in stewardship is not to limit antibiotics, but to give people a leg up and the best way forward by giving them actionable guidelines. At UW, everyone carries in their phone as an app, and also on every workstation, Occam. Occam is the online clinical care advisories and messages. And when it comes to antibiotics, yep, there's an app for that. There's an antibiotic reference kit that they all carry. That's true both for antibiotics and other things that we do. All of our guidelines are in this centralized repository, but the most popular little applet is, of course, the antibiotic reference kit. And that's because we don't just give an antibiogram. We give residents, students, attendings, guidelines for the different syndromes they're going to see. You tap any one of these tiles on your phone, and you instantly get our updated guidelines for how those patients should be treated. And at the same time, we also copy those right into Epic. Yes, we are an Epic place. If you haven't done Epic before, or you're just Epic curious, it's okay. You can do this. And here's one example why. Stewardship has built antibiotics directly into a whole bunch of order sets, including our sepsis order set. Anybody septic at UW, we just have the doctor type SOS, and up comes a list of all this stuff for sepsis, labs, fluids, crystalloids, and yes, antibiotics. And the antibiotic kit that you see here is identical to what we have already built in Occam for teaching purposes. Why is this important to you that residents have an easy button to push? Because I think it decompresses the fellows. We have very few antibiotics under restrictions. The antibiotic stewardship pager does not go to our fellows. It comes to us as faculty. Why? Because we empower the residents to use what they need when they need it. So antibiotic stewardship paging, not a big burden to our fellows. We trust our residents, and we also have their back and verify that what they're doing is correct. Reason number 3, tight links to microbiology and infection control. And We're really proud of the fact that the Kirby-Bauer disc was invented here, and we pay that forward for all the generations by making sure that our fellows spend time in microbiology at least 3 times per week, and that they also communicate very regularly with our directors of infection control. Stewardship, infection control, microbiology, and clinical ID. It's all part of one process. And as you can see here, our fellows really enjoy being down in the lab. Reason number 4, antimicrobial stewardship. Yes, we have been doing online stewardship long time before COVID came along and forced all of us to work on Zoom. The way this works is that we are really the reference medical center for 5 states: Washington, Wyoming, Alaska, Montana, Idaho. This is your place. Many of these hospitals in those 5 states are very small. We call them rural and critical access hospitals. It's critical that the people in that community have access. That's great. By definition, they are 25 beds or less, and that means that they're under-resourced. And so they want to do a great job with antimicrobial stewardship, but they often don't have an ID doctor or a pharmacist to talk to. So years ago, we started reaching out to these hospitals and built a network of antimicrobial stewardship across the state and the region. And we are now nationwide with close to 100 hospitals, coast to coast. It's no longer just stewardship for antibiotics. This is now what we call UW's Center for Stewardship in Medicine. And that includes primarily antibiotic stewardship, but also diagnostic stewardship and a whole bunch of other exciting initiatives. We meet with the community at least twice a week, and our fellows are always involved in that process too. It's a great way to connect with smaller hospitals that are serving less advantaged populations. And it's also really fun and exciting thing to do. And we think it's a model for how stewardship will probably look moving forward over time. And finally, my 5th reason why is it so good to be here. We love working with ID fellows. There are many examples of projects that we've done with fellows over the years. Here's one. This was done by Dr. Vidya Atluri, who's now faculty in the California system. She was our fellow not too long ago. And she became upset that we had so many patients with inaccurate, false allergies labeled in their chart. 10% of Americans think they're allergic to penicillin, and only 10% of them are correct. The other 90%, it's just wrong. It's fake news. And that leads to all kinds of problems with toxic and suboptimal use of antibiotics, higher risk for failure. And so this made us scream and curse and blew our flippin' minds that we were doing the wrong thing nationally with antibiotics based on the wrong information. At the same time, we're also the division of allergy and infectious diseases. And so we have real leaders who are immunologists and allergists, and they have guided us towards this growing national body of literature showing that, well, basically that penicillin allergies are number 1, usually bogus, and number 2, even in anaphylaxis, most of those patients can safely receive a 1st-generation cephalosporin. So that's a big sea change, and all this information has come together into a more recent practice parameter update from last year. Great document, 200 pages long. What we have done with Vidya's help and in partnership with the allergists and pharmacists is to create a very simple guideline for patients labeled with penicillin allergies and cephalosporin allergies. Are they red light? You can never get a beta-lactam. Green light, you're totally good to go. Or yellow light. Let's do a little bit more testing and discussion. Most of this can be handled via not just skin testing, but actually by having a conversation with that patient to figure out whether they actually need this special kind of testing, et cetera. So we've created an app. Yep, there's an app for that. It's called Pallergy, your pal in the fight against bogus antibiotic allergies. Vidya was our fellow, now faculty in California. And in this very multidisciplinary approach, we've actually come together to create a way to talk to patients within about 1 or 2 minutes and come to an agreement about what is necessary to do for these folks. It's just one of many examples of the things we like to do with our fellows. So those are my top 5 reasons why I like being a steward here at UW. And I think when you come here and apply with our team, talk with our fellows, ask them how they feel about antibiotics, ask them how they feel in terms of their comfort and their confidence doing the right thing with antibiotics. And I think you'll be very, very impressed. Our fellows really sell the program because they're happy and amazing people. And so I hope you get a chance to talk with them about this too. If you have any questions about this, please reach out to me. My email is abx, Alpha Bravo X-ray, at uw.edu, and I'd be happy to hear from you anytime. Thank you.